Good morning, my name is Tamara Johnson. I'm going to be doing a little presentation for our pharmacology class. The drugs I'm going to be talking about are indomethacin, ibuprofen, and then the paracetamol or Tylenol. The reason I chose 3 is because we're going to be talking about patent ductus arteriosus. I'm going to be referring to it as a PDA. So in utero, whenever a baby is developing, they have a different circulation than they do whenever they're born. Their lungs need to be bypassed, and so there's a PDA, a patent ductus arteriosus, so that the blood does not flow through the lungs. The placenta is able to supply the baby with the oxygen that's needed. As soon as a baby's born, they take their first cry. That's whenever you see structural changes happening in the heart, and you want the PDA to close. Whenever babies are born very premature, sometimes that PDA does not close, and there's different interventions. You can do medication, you can do surgery, or the baby may need a heart cath later in life to close that. The reason you want the PDA to be closed is because you're going to have oxygenated blood mixing with unoxygenated blood, and then the oxygenated blood is going to recirculate in the heart and not get out to the body, and that's whenever you can it can cause issues in babies. And so the treatment of choice has been indomethacin and ibuprofen, but they are now looking at treatments of the paracetamol, which is a Tylenol. So the indomethacin and the ibuprofen are NSAIDs, which those can lead to increased bleeding. They can cause renal issues, and so they cannot be used in babies with renal insufficiencies, with GI bleeds, with brain bleeds. And so they're looking at using medicines like Tylenol. So what happens is, with these 3 medications, they inhibit prostaglandins that are needed to keep the PDA open. And so whenever the prostaglandins are inhibited, that PDA is able to close. It usually takes about a 2-day course of getting the medications, whether in any of the medicines that you're using, and the PDA can close with that. That is definitely the least invasive, the less risky. So the babies that are able to use these can be treated without surgery. As far as drug interaction, there's really not big drug interactions happening. It's very safe for these babies, and it's able to close this PDA pretty quickly. Safety, like I mentioned, we're already decreasing the risks because the baby does not have to undergo surgery. The risk could be involved if the baby has a brain bleed. They can't use the indomethacin or the ibuprofen. If they've had GI bleeds, they can't use those medications. And so that's why they're looking at the Tylenol, because that is not going to increase bleeding. It's not going to decrease platelets. It's not going to cause more GI bleeds or more interventricular bleeds. And so the expected outcome is the PDA closes, the baby is now hemodynamically stable, which will help the baby be able to transition into life and be healthy.